pretty tech savvy too, but I'm such an extrovert that I just start talking and forget that I'm muted.
Yeah.
Muted out by now.
Happens a lot.
Oh, yes, I am definitely going to go over all of that tonight.
I was telling them I signed up this morning and I can go on the 27th, which was wonderful. Yeah, that's what I say.
Right. Yeah, we're trying hard to get out to everybody. We'll talk about that. If there's so much demand and there's not a lot of vaccine and the systems are so new, we're going to get to everybody. It's going to start to flow here in a couple of weeks. As soon as we get more vaccines coming into the state, it's going to be better too, but we'll talk about that too. Hi, Dr. Bovey.
Hi, Lois. Hi, Chris. Thank you for joining us tonight. Dave will be up shortly. He's having some difficulties getting onto the internet.
Wow. Hi, Nick.
Always something.
That's better, Nick. Now we see your face, not just the top of your head.
Yeah. After a while, I got it worked out.
I just wanted you to see my better half.
Oh, and then Nick. Yeah.
Here we go.
Yeah. Where's the rest of the board?
Derek, have you heard from anyone else?
We're working on Dave's right now. I haven't heard from Marie or Matt yet. I'll send them a
Okay,
text.
thanks.
Well, Roland.
We have a quorum. That's all that matters, right?
Yeah. Yeah, okay.
Make it an official meeting anyway, but
Yeah.
I'm sure they got tied up in something.
Oh, yeah. Hi, Susan. Okay. I'm going to go get my coffee.
And then you leave, everyone will show up.
That's what I'm hoping. Okay, where are they?
You're safe.
Okay, Dave will be on in a minute.
Great, thank you.
Hi, Matt. You're late.
I've been sitting here for about 4 minutes now.
Just kidding.
That was very bizarre.
Hi, Dave.
Dave, just give me a hands up and I'll go live when you're ready.
Okay, it'll be like in 2 seconds here. All set, Pam, we'll go live.
Oh, yeah.
I'm assuming we're live right now. So I'm going to call this Topsom Board of Selectmen meeting to order, January 21st, 2021. And because of technical difficulties, imagine a flag somewhere behind me. And would you all please rise for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Patty, how about you do that roll call, please?
I would be honored. David Douglas,
I am here.
Marie Brilliant, Ruth Lyons,
Here.
Matt Nixon, Roland Tufts.
Here.
All here except Marie Brilliant.
Thank you, Patty. We are on to the town manager's report, and due to circumstances again and strapping masks on and everything, I'm going to read them to you. So this is from Derek. Good evening. As a free service to the residents of Topsom, the solid waste facility will implement a paint care program on Tuesday, February 2nd. This program allows residents to dispose of oil and latex-based paint free of charge. There'll be a 5-gallon limit per drop off initially. For more information, pamphlets will be available at the solid waste facility in Town Hall. Information will also be on the town's website and TV3. I would like to extend our thanks to Mrs. Lois Skillings and Dr. Christopher Bowe from Midcoast Hospital for joining us tonight. We certainly appreciate the strong relationship you have with our community and keeping the public informed of Midcoast Hospital's response to the COVID-19 pandemic. Also like to thank the Topsom Solar Advocates for their efforts, which led to Topsom's first municipal solar project. We look forward to working with the newly formed Energy Committee, and thank you for being here tonight and providing us with an update. Thank you, Derek Skripchansky. I hope there's no questions. Email them in the morning if there are. All right. We are already to boards, committee reports, and updates. First of all, we'll jump right into Midcoast Hospital. Lois Skillings, President and CEO of Midcoast Parkview Health, and Christopher Bowe, MD, Vice President, Medical Administrator, and Chief Medical Officer. I've given all the titles. Feel free to go who wants first.
Well, thank you all so much for giving us some time this evening. We'd like to bring you all up to speed about our large-scale regional vaccine center that we're opening on Monday. And if it's okay, I could share a screen and show PowerPoint slides, and then we'll have time for questions. Is it okay for me to share my screen?
Go for it. Thumbs up.
I would do that if I could, but
Yep,
all of
you
a
can.
sudden, all of a sudden, I'm having a little technical difficulty. Let me try again here.
It's in the water.
It is. So hang on one second. This is always a, it's always a thing here. Just having trouble seeing it here. I don't see it here. Well, let me back out of it and try again. This has not happened to me before. Let me just get some of these other things out of here. So anyway, what I'll do is just put it on my screen and see if I can get out of it and open it back up again. And let me save it here. So we have a lot of exciting things to talk to you about tonight, because believe me, this has been a big situation of us working with so many of our colleagues to get ready for this large-scale vaccine clinic. Let me see now if I try again if it will open. Okay, hang on a second. You guys are all so patient. Nope, it's still not there. So maybe I just don't have authorization to share it. So instead, you know what? I'm just going to talk you through it, and you can see me and I won't see you, and that'll be fine. So we've been collaborating with the town of Brunswick to open a large-scale regional vaccination clinic on Monday, January 25th. We feel that having this centrally located will help this entire region. There's about, depending on which planning statistic you use, the Mid-Coast health service area is around 90,000 people, but some, if you take off Wiscasset and a little bit into Freeport or Pownell, where I grew up, it's maybe 75,000 people that we serve. But either way you slice it, this is a pretty large region of Maine. And if we just did small community-based vaccine clinics, we would be vaccinating people for years, because really having a large-scale operation will allow us to put many people through and get this pandemic behind us. The single most important way to turn the tide of this pandemic is mass vaccination of the public. So after talking to different people throughout the community, looking at sites that could be immediately available, like turn on a dime, get it done. Very grateful for support of Bowdoin College to offer some places, but we ended up looking at the Brunswick Parks and Recreation Center on Brunswick Landing. The flow in and out, we're doing a lot of wayfinding work with the Brunswick Police Department to ensure that people can find their way to the Parks and Rec building. It's a 20,000 square foot building that has a lot of parking. And what's good about it is that it does take a little while to get in and out, so there won't be large traffic jams. We will serve the community members of Brunswick, Bath, Topsham, Harpswell, and all the surrounding towns in this region of Maine. And we're offering these vaccinations by appointment to reduce long lines and wait times. And that's a safety issue too. The last thing we want is our vulnerable seniors, especially this time of year, waiting outside. I mean, you see the pictures on the news of folks like Florida and other places where you see people with even walkers and wheelchairs waiting outside in line. This will avoid long wait lines by having appointments to do this. So it will also help us to cover this whole region of Maine quickly and safely. And pending supply vaccine of the vaccine, and this is the most important message that you take home tonight and that your viewers take home, all of this really depends on the amount of supply that we get. But we are prepared, and we are designated as a large-scale site in the state of Maine to be able to do 800 vaccines a day, 6 days a week. This will allow us to do 10,000 first doses, because these doses of vaccine are actually given once, and then 3 to 4 weeks later, you get a booster shot, and an additional 10,000 second doses every month. So we'll actually be putting 20,000 people through this center. And this will also be supplemented with other vaccine efforts by local pharmacies, such as I'm sure CVS and Walgreens and others will also have vaccine available. They just won't be able to have this kind of throughput, so it may take longer. Additionally, as you know, we've already vaccinated healthcare workers and also long-term care, assisted living, and congregate living facilities for the past few weeks, and for the coming few weeks. the pharmacies are actually going into those facilities and vaccinating the residents and the staff of places like the Highlands and other long-term care or assisted living or congregate living facilities. So there is vaccine getting out, but working with the state of Maine, CDC, it was really felt that having some large-scale centers would actually get a large number of the population through more quickly. And Chris, do you need me to email this to you? You all set?
No, I'm fine.
Okay.
And I'm sure I'll miss a couple points and you
Okay.
can pick it up.
I'll do the next slide and then I'll turn it over to you on
Sure.
slide 5. So we have had close community partnerships. In addition to Brunswick, I just want to say that Derek in Topsom has been just fabulous. I've reached out to him several times, along with the towns of Bath and Harpswell. They're all engaged and supportive. And all of our local police departments have actually talked about helping to work together to help provide some law enforcement presence there, to assist with traffic flow and wayfinding initially, but also to provide some sense of safety there, recognizing that there's a lot of people coming in and out. A lot of people are anxious. We've had folks come to our current vaccine site that we've been vaccinating our medical professionals from throughout the community. And people are anxious about this. So having some law enforcement support there is going to be really helpful for us. And Mid-Coast Medical Group and Martins Point and the other primary care groups in the community are working with us to collaborate on patient communication, such as vaccine scheduling and also staffing the vaccination center with clinical professionals. And Bowdoin College has also been very supportive every step of the way. So we really recognize this as a regional asset, not a Brunswick asset. It's a Topsom asset, a Bath asset as it is Bowdoin, Bowdenham, and Harpswell in this whole region. And you don't have to be a patient of Martins Point or Mid-Coast Medical Group to get your vaccine here. The vaccines will be open to the public. This is a wide open. We're just using the physician group's lists of actually reaching patients, and Dr. Bovey's going to talk about that a little bit more. So over to you, Chris.
Absolutely. So just to emphasize, we received vaccine from the state. The state CDC, Maine CDC, is determining the criteria of which category of individuals we can vaccinate. And of course, we're just following those state recommendations. We've certainly had questions asked of different situations and scenarios where people are at higher risk and wonder if they fit the criteria for a vaccine. And really, it's the state that's determining it. And the key group right now are individuals age 70 and plus is who the next category they've moved to. So our efforts are full bore to immunize our community. So we have different ways to have those patient populations reach out to us. Certainly, we have emails of a lot of our patients, and we're emailing them. We're asking our colleagues at Martins Point and other settings to connect with their patients as well to schedule them. We're calling patients to schedule. And then probably the key way for community members or someone who does not have a primary care physician is to reach out we have a Maine Health COVID vaccine line. And that line has been overrun a little bit, right? When the news first came out that you could get an immunization if you're age 70 or older, that line actually had 70,000 phone calls one day before noon. So that line was pretty overpowered. However, the system is building up a large call list so that we're capable of handling calls from the community. And that's a way for our community to get in and get in touch with us. A simple way to get there is through our website, just at midcoasthealth.com. And if you hit /vaccine, it'll take a person right to the website for the Maine Health Vaccine Call Center. You may have difficulty getting through initially because it's been very busy with a large volume, but it can tell you if you're meeting criteria to get a vaccine, and then it can help someone sign up for a scheduled appointment. We would love to be scheduling appointments 3 weeks out and 4 weeks out. I think we'd provide a lot of relief to the community if we could schedule you for an appointment. If you had an appointment on February 27th, I have a feeling that would feel good, at least to know you have an appointment. Unfortunately, at the moment, we're having challenges planning out because we just don't know about our vaccine supply. That's the rate limiting step right now, is our vaccine supply. But as soon as we find out what we have available, we will open up appointments. Once we know what we'll have available, we get a different shipment each week. We typically find out as a system on Thursday what we'll receive the next Tuesday, sometimes Monday, Tuesday, Wednesday. So we find out our supply, and our goal is to administer all the vaccine we receive. We do not intend to hold back vaccine. We want to find out we're getting 1,000 doses. We want to administer 1,000 doses. And ultimately, our goal is to administer, as Lois was saying, 2,400 new doses a week and nearly 10,000 a month, where we get someone's first dose in. We'll be able to follow up with the second dose. We schedule that at the time of the person's first vaccination. We'll schedule your second vaccination right at that time. We update information into the vaccination system so we can record who's been vaccinated. And if somebody has a physician in our network or in a different network, we're happy to send them the information so that your doctor has records that you've been immunized. As Lois said, a key point is that these are by appointment. We can't really have it overrun, and we can't have a situation where more people are there than vaccine that we have. This vaccine is challenging to handle in that it needs ultra cold storage. In fact, we've been using the Pfizer vaccine that needs to be stored at minus 70 degrees Fahrenheit. So we need to know exactly how much vaccine we have and then have that number of patients that we can administer it to. And then this vaccine to be done safely, we need it in a spot where we can observe people for 15 minutes. People who've had a history of allergic reactions, we observe for a longer period of time. And then, of course, in the times of COVID, we need to have space so that we can keep people apart. We want to keep our social distancing. We want to keep people masked. And the last thing we can have is an event where we're trying to immunize and protect people from COVID, and in fact, we spread COVID. So we're working very hard to make sure we're safe in our administration site, that we can keep people apart, we can keep our masks, we can keep our distance, we can safely schedule your next visit, and we can watch people to make certain that they're safe while we take care of them with their immunization. So we're excited about that. A couple other key points for everyone. There's no charge to an individual to be vaccinated. In fact, the federal government is paying for the vaccine. So we do collect information from a person's insurance, as we can work with an insurer, but there's no charge to a patient, and that's important for people to know. No charge for the service at all. And again, the best ways to get connected are with the Maine Health COVID vaccine line. Again, we apologize that it's taking some time to get through because there's a lot of people waiting to get vaccinated. And as soon as we find out what we have for vaccine, we'll open up more appointments each week and have people coming in. So we're very excited to do this and to do this with the community. We're very excited also for anyone else who's immunizing. So if someone has another way to get immunized, please take advantage of that. If, you know, perhaps the individuals who live at the Highlands and someone's going to come there and immunize people, great, please get immunized. So we're not trying to corner the market on delivering vaccine. We would love people to get immunized any way that you can, but knowing that we can get a high volume through, we can really work through our community quickly and as efficiently as possible. So that's certainly our goal with this process, to do it safely and efficiently and as quickly as possible. I'll turn it back to you, Lois.
Thank you, Dr. Bovee. And so the operations again are going to be Monday through Saturday, 7 a.m. to 8 p.m. And so this is going to be staffed by doctors and nurses and support staff, and will be administered by these healthcare professionals with pharmacists drawing it up. But we'll have emergency procedures on the ready, because this injection is different than the flu vaccine in that it requires some monitoring after. People are asked to stay for 15 minutes. After, to be watched to see if they're having any reaction, and people who have a history of allergic reaction are asked to stay for 30 minutes. So it's a very, it's a healthcare oriented environment. So that's another reason why that it's not being done outside in other community settings. Plus, it would just take too long to get the large number of people through. So I just sent these slides to Derek and to Andrew. And so, but I want to tell the phone number of this COVID vaccine line is 780-7545. And again, they're getting thousands of calls. And so that's why there's many ways for us to get people scheduled. We're doing outreach by telephone calls and emails this week. I think, Chris, we've done 2,500 vaccines this week.
Yeah, we're scheduled for,
Scheduled for
we
next-
have 2,400 slots next week. In our current site, we can do 320 a day,
Yeah.
and we have 5 days a week. So we have 1,600 in our current site. But moving to this new spot will be 2,400 new and up to 4,800 a week, so we can get those second doses in. Yep.
So I know while people may feel anxious that they haven't heard or they haven't received an email from Martins Point or from Midcoast or from the Topsom Central Maine group, it doesn't mean that you won't hear, that you will either get an email or a phone call, because we know many people may not have email. But that's why there's this other way too of calling this call center, so that you can, if you call today, there are so many people calling that you probably won't speak with the person, sort of like the airline. They'll say, leave your name and number and we'll call you back. And they have staff dedicated to just scheduling people in this region of Maine at that call center. So it's actually just going to take a little while for us to get the supply of vaccine in and to get the system down. But we are really devoted to getting every single person over 70 years old in this region of Maine vaccinated as soon as possible. And we're asking people, all of us, you may have received a letter actually from your primary care provider asking not to call the practices. What's happening is people are making so many calls about vaccines to the doctor's offices. They're not able to get scheduled patients in who are sick. So if you can just have some patience and recognize that we'll get to that point where we'll be able to reach everybody, and to also recognize that even once you've had the vaccine and until you get it, to continue to avoid gatherings, wear masks and maintain your distance. Contact your primary care provider for all of your screenings, acute care, and management of chronic conditions, because even though we are having another surge of COVID right now throughout the state of Maine, we have very safe conditions here to make sure that they are separated. People with COVID infection are separated, and that we're able to provide that care for you so that you get the care that you need. So I hope that you will have a chance to look at this PowerPoint, and Chris and I would just love to answer any questions that you may have.
Go ahead, Matt.
Thank you, both of you. That was a great presentation, very heartening. I just had a question, logistically speaking, about distribution. I think there were a couple of numbers thrown around about how many you hope to be able to hit when you open up the new facility. And I was just doing some basic math, just looking at the population of Saginaw County and the town of Brunswick.
Mm-hmm.
And that's around 55,000 people.
Mm-hmm.
So logistically speaking, what happens if we vaccinate a proportion of the population that's 70 plus over? According to the rate that you had mentioned earlier, it would be pretty quick, I would imagine. So what happens then after that? Do we start bringing people in from the rest of the state, or do we start looking at our counties, the rest of our county's population?
Well, I think what will happen, because this is a pretty big part of the state, we anticipate that we have about 15,000 or so between us and Martins Point and the Topsom group of people who are over 70. But that's just a rough number here. So once we're through with that, other parts of the state may actually finish with their 70 and older people quicker because they have a smaller population. So that's why vaccines and resources may be diverted to these larger centers so that we can get people through quickly. Once the state feels that we're in a good place with over 70, then they will release vaccines and allow us to give vaccines to people who are over 65 and who may have other chronic health conditions. And that's why today we're not allowed to make any independent decisions, no matter what kind of it may make sense that people really want to have a vaccine. We're only giving vaccines to who the state says it's their turn right now based on these priorities set by the CDC here in Maine. So once we're through with 70-year-olds, I'm sure they'll move us then to the 65 and older, plus people who have chronic health conditions. And
right.
then
And The state has some criteria for different people who are in group 1B. So 1A was the healthcare workers, people in congregate living facilities, and people who care for them in congregate living facilities, nursing homes, senior living centers. The 1B group is federally, they've recommended age 65 and above. Maine has started with age 70 and above. So when the state CDC says down to age 65, and the rest of group 1B has a number of people that would include grocery store workers and teachers and other categories. So again, when the state tells us we're in this category and immunize them, then we'll be actively reaching out and having that pathway for people to reach out to us to schedule them. So as soon as the state gives us the green light and we have the vaccine, we'll be ready to give it to any group they tell us. And then hopefully before long, we'll get to anybody who wants the vaccine and didn't fit into an earlier group. We'll be very excited for that moment.
And just so you know, we're already working with other people in 1B, like reaching out to Crooker, all the local school systems, even working with Bath Iron Works, so that when the state says we're ready to go for this next level of essential workers, we'll be able to, we're not going to miss a beat waiting for that. We're building the infrastructure now to get our teachers in, to get our other essential healthcare workers in, so that we'll be ready to go once we have the vaccine, which is the biggest thing right now. That we really, that's our concern. I mean, we thought we were going to have more vaccine coming into the state even this week and next week, and we've learned that we aren't getting that. But there's a lot of feeling that it will loosen up in the next few weeks.
Thank you. And I should have couched my question with that preface that that's in the perfect world, we'd be getting our maximum amount of vaccine there. Yeah. So that was, thank you for that.
Yeah.
Roland?
Yeah, thank you. Great presentations always. I appreciate that. I'm glad you reiterated that there is no cost for this vaccine, because there are a number of scams out there where people are being called to register for vaccinations and there's a fee attached to it. Yeah. So we can't stress enough that those calls should not be taken.
If anyone asks you for money, it's a scam.
Right.
Or credit card number or anything on the phone. Yep.
Exactly.
Your bank account, nothing. Thank you so much for all that. We need, and I think it's really great. I know local police departments are doing everything they can to get that word out to people, because we're very concerned about that.
Thanks again for all your hard work, Bill. Appreciate it.
Lois, probably a question more on your hospital end, not vaccination end. You talk about the other places, CVS, Walgreens, any other non-medical location doing this, and you talked about how serious it is observing for 15 minutes, maybe up to 30. As the hospital side, have you guys had any conversations with these locations? How are they managing that? Is there a potential for a strain on the EMS system? Is that their answer, to simply call 911, or do they have added level of care?
It's a great question. I think that there are probably pretty clear recommendations for pharmacies administering the vaccines. I can't say that I know the recommendation for a private pharmacy to administer the vaccine. I know the recommendations for the vaccine is that you have a required 15-minute observation period. It is challenging, again, in the time of COVID, to give someone a vaccine and have them 15 minutes in your sight line, but yet far enough away from other individuals that it makes it hard to figure out how we can move a significant volume through a normal space, through a normal retail pharmacy space or something like that. I'm sure the requirements are in place of how they would manage that, but I suspect you're correct that it would involve activating the EMS team if symptoms were to arise. But we will on occasion activate EMS as well. We have health professionals there to assess people, but if someone starts to have a significant reaction, we'll get help for them as well. And we've seen some reactions to the shots, but in general, it's a sore arm or achiness, muscle aches a day later, and that typically happens more often with our second dose than our first dose. We've seen about a rate of about 2% of people having symptoms, particularly after their second dose, through our employee health. And very few people have had a significant reaction. Most of them have had a history of a significant reaction. In fact, carry an epinephrine pen because they know they've had these serious reactions. So that is fortunate, but at the same point, not everything is predictable. And we feel fortunate to have a spot and a space where we can watch a large number of people get these vaccines through and, and really provide that ongoing observation. We will have a dedicated nurse or physician who is just watching people for that 15-minute time period.
And we might be a little ahead of the game on this, but we are planning operations now with CHANS, our home care agency, to actually bring COVID vaccine to homebound patients in the community. We're starting with the people that we easily can identify because we're providing services in their home right now. And then we'll branch out to that, working with our social service agencies in the community to help to identify people who may have a hard time getting in for the vaccine. That will happen. That it's not going to start this week, but it will happen soon, that we will be doing that kind of outreach as well. Our goal is really to get as many shots in arms as we can, as soon as we can. The sooner we can do that, we're going to have this pandemic under control. And that's our motivation for this, is to just get as many people in as we can, as soon as we can.
And I just want to go over this so anyone listening at home, they call the 877 number, they schedule an appointment. Will the appointments only be scheduled once there's a confirmation of how many doses per week?
Yes.
Or, okay. So
Yeah.
If you have an appointment, you are good.
If you have an appointment, you're good. In
Okay.
fact, we, for next week, they're still working. We still have some openings for the following week. We scaled back, even though we could do 2,400. We're only confident that we're going to have 900 vaccines. So we're only going to schedule 900 because there's no way we can call back everybody to say, I'm sorry, we don't have the vaccine. So as soon as we have vaccine open, we're doing this massive outreach so that we can get to people. So that's why I think the real message is that don't worry about it. If you can take a deep breath and realize that, we're on it. We've got, Martin's Point has their list. We have our list. I'm sure the Thompson Group has their list of doing this outreach to 70 and older people. And then you can also call this 877 number as well. And that will kind of get you on the list so that even if we don't have a vaccine, calling that number, you're on the list to get a call when we get the vaccine.
And an appropriate kind of warning to people that calling that number, unfortunately, again, we would love to have appointments scheduled through the whole month of February. And we would love to have 2,400 appointments per week through the whole month of February, and people could get appointments all the way out. We just don't know about the vaccine availability. So again, calling that number, that is a great way to get scheduled, but recognize that a lot of people are calling that number. It's taking some time to get through all those calls. And then a message that fits with that is none of our primary care practices, our colleagues at Martin's Point, I believe our colleagues at Thompson Family Medicine, I don't think any of them can schedule into this clinic. So certainly reach out to your doctor if you have health concerns, reach out to your provider for any care or questions you may have. But unfortunately, reaching out to them won't help you get scheduled for the vaccination clinic at this moment. So if you're trying to get scheduled for a vaccine, that number is our way to go, or the website connecting you to it. Those are the ways to get scheduled. Certainly reach out to your doctor for other healthcare concerns. They're always there for you.
Ruth?
Thank you both for the information. It's just so wonderful. And I just want to say I did use the phone number and nobody called me back because there was a lot of prompts, and that was wonderful. If you don't have allergies or it's not, it just asks you a number of things and you just keep hitting either 1, 2, or 3. And I went through the whole series and said, you will be put on the list or something like that. There was, I also went to the website, and that is, I can't remember if you said it. It's midcoasthealth.com/vaccine. And that got me to where I wanted to go. I signed up for it, and I'm all on for the 27th. And it was pretty easy and very easy to follow. But so I just wanted to put that out there. I'm not sure people knew about the prompts. And it isn't just a phone call and we'll get back to you. It was a whole bunch of prompts they give you.
And that's why just asking folks to be some supportive, to recognize is that this is not a perfect system, because everybody's building it so fast. And we had access to emails and we thought that's going to be the quickest way to get. So everybody who has an email that's in our system is already loaded in the system. So they, that's one way. Another way is making phone calls, because some people don't have emails. So we started making phone calls this week, so that we can help them get it scheduled. And then the third way is this calling this number. And now if you call, they'll have since they're literally probably not going to be able to answer the phone, so many calls are coming through, you just leave your name and phone number and they'll call you back and help you to do that. So it's multimodal. If we just had one perfect way, it would never get done. And so.
And to share about the call center is actually open from 8 in the morning until 7 at night. So, calling at 9 o'clock at night is not going to help you. But that website, yeah, you had it correct. It's midcoasthealth.com/vaccine, and that will take you right to the site. You can click on a button to see if you qualify to get the vaccine. Of course, it's pretty simple. If you're age 70 or older, the answer is yes. But you can go through other questions about being qualified and then click on how you register for a test.
And just a little, you might be interested in hearing some of this behind the scenes work. Literally in a week, Maine Health redirected over 50 people to staff up a call center and put the IT systems and the phone lines and everything else. They just took staff from all over their system and stood up this call center and I'm just so impressed with how fast they did it. And it's, and again, all this will settle in the next few weeks once the vaccines start running in and we start actually getting to people.
Are there any other questions? Go ahead, Marie. You're on mute, Marie. You're muted.
Is that working now?
Yes. Yeah.
Yeah? No?
Yeah, we can hear you.
Okay. All right. I just wanted to apologize for joining late. And I've heard you saying something about an 877 number.
Mm-hmm.
And what number would that be?
Complete? It's 877-780-7545. And that's also on the slide deck that I sent to Derek and Andrew. So maybe they can put that slide deck up on your website or something to help people to find it.
That is the
You'll
plan.
also get that number if you go to our website too. You'll get that number if you go to our website.
Lois, that's also the plan tomorrow morning. Once this update was given,
good,
it will be going to our front page of the website. Took a lot of information out of your press release. So all of this will be right there to redirect and where to go. Marie, you have anything else?
No.
No. Also, Lois, I'm not seeing any other hands, so we may be wrapping. Derek wants me to relay to you that he and staff, through your logistics, anything you need volunteers, they're willing to do it as you're trying to work through your logistics, the town to help in any way to do it, not just the police force, but volunteers from the town itself.
Thank you so much. And we will definitely take you up on that. We are so overwhelmed by the outpouring of support of volunteers. I can't even tell you. They're coming in so fast that we can't even manage it right now. But we will need it because this is a long haul. We're going to be doing this until probably the end of July is what we figured. So so if you, we're just so grateful for that, that support, and we'll get more volunteers as we get settled in a little bit and get things organized.
Yeah, Lois has said it well that we're asking for patience from our volunteers too. We're going to need the help, but we're going to get it up and running and then see what we need and then reach out, because we know we've been very much appreciative of all the offers, and we will benefit from having volunteers helping us out.
We've got lots of retired doctors and nurses who were already pressed into service, so they're going to be there next week. So that'll be helpful too, but we're going to need people who aren't doctors and nurses helping too, so.
Excellent. I'm looking around the room here. Thank you very much. I've got that written down, so hopefully by the end of the meeting, I'm going to make sure we get that 877 number plus your website one last time as we go, so people can reference it. And thank you very much for the update. Best of luck to you. It looks like one heck of a logistics plan on your plate, and you probably don't know what you don't know yet.
Yeah,
exactly.
It's been fortunate to have a clinic with 1,500 shots a week to build up to this. But yeah, we'll be almost double that, almost triple that. So yeah. Great.
Thank you.
Thank
Have
you.
a good night, folks.
Bye. Thank you.
We are on to update from the Energy Committee. We have Nick Watley and Yvette Meunier with us tonight. There's Yvette and we got Nick. There, he moved. There we go. We got everyone now. Everyone's on the screen. Go ahead. Whoever wants to kick it off, welcome and fire away.
Yeah, Yvette has written the update, so she is going to give it to you. How's that sound?
All right. Thanks, Nick. Good evening, Topsum. This month marks a year since the request for a proposal was issued for a power purchase agreement for the town of Topsum's municipal use. Just as a refresher to folks, town uses 750,000 kilowatt hours annually at a cost of $159,000 a year. And Topsum has now signed a 20-year contract with Revision Energy to purchase energy from Maine's first multi-municipal solar array in Skowhegan. And we are joined by Dover Foxcroft, Rockland, Vassalboro Community School, and Rangeley in supporting this project. This past November, representatives from the Topsum Solar Advocates who spearheaded this project attended a ribbon cutting ceremony at the site, along with other representatives from the other communities. There's a photo of this gathering in tonight's packet, but what we couldn't fit in tonight's packet was the large framed photo of the 18-acre, 10,500 panel solar array, but it will be on display at the town office, so you can see it there. We are pleased to announce that the system is operational, and this month we will be receiving our first energy credits, saving the town $38,000 a year, or 24% annually, and over the 20-year contract, $800,000 in savings. In the coming months, you'll also be able to see live energy production on the town's website. Now, several of Topsum Solar Advocates have joined the ranks with other energy-minded residents in the newly formed Energy Committee, which began meeting this winter. Some of our upcoming projects the committee is pursuing includes investigating converting Topsum streetlights to LEDs, taking over the ownership of our streetlights from CMP to save on lease payments, and viable models for EV charging stations at municipal buildings. So come join the action every fourth Tuesday of the month at 4:30 p.m. or catch up with us on our webpage, which is topsummaine.com/energy.
And Yvette, Derek just brought in the first frame picture of the first. I don't have it up here. It's over there because we're kind of sharing it. But we have that, and it's ready to go up in the town hall. It's all framed and ready to go.
Awesome.
Nice.
Any questions of the committee right off?
You guys having fun?
Oh, yeah. Yeah, that's what it's all about.
it sounds good, and thank you for your work and diligence with this. And I think it certainly is going to benefit the town of Topsom and eventually maybe some residents and more people can get on board.
That's what we're hoping.
Good job.
Is that, Ruth brings up a good point. Is that one of the, you guys are really early on, I get it. Are you working early on attempting to do some outreach also, not just the municipal side, but outreach into the community? See what you can bring that way? Or I know when we did interviews, and I forget her name, one of the things she wanted to talk about was, how to help people do it for their home. Is that something early on? And I know it's only a couple months in, but a couple meetings in. Is that something you guys are tackling right off?
I wouldn't say we're tackling it right off. We've talked about it. But the main thing right now, because the streetlight project was kind of off and running, we're trying to put, a lot of focus on that and really just trying to set an overall longer term agenda.
Yep.
But there are some really exciting things happening in community solar, and we do intend to be kind of a clearinghouse and have information available for the public, because there are actual, 10% savings over your regular electric bill, and there's some really viable options coming up, and some not so viable ones, but we're investigating which are the best.
That's great that you do that legwork and, saying that there's some out there that aren't viable, and that probably helps people make their decision when someone's done that.
Yeah.
Thank you for the update, folks. Anytime you feel like, Matt, you just thumbs up. Sorry. I thought you were raising. Let us know next time you want to give update and we'll get you right in.
All right.
Thank
All
you.
right, thanks.
Thanks a lot.
Thank you. Next up, update TDI ECD, John Shattuck, Topsom Economic and Community Development, Inc. Director. John.
Good evening. Thanks for your time. Just 3 items tonight. About a month ago, I heard from some representatives from Access Endodontics, and they were working on closing on a property here in Topsom on Park Drive. Last week, TDI met in a special meeting because the property they were buying is within the 1996 business park agreement and covenant area. And the board met and quickly determined that, unsurprisingly, this professional office use was a permitted, even an encouraged use, and approved it. And with that approval, Access Endodontics closed on their purchase today. And so I'm pleased to welcome a new business in Access to Topsom. I serve on the Cadence River Education Alliance board, and CREA, like most businesses or organizations, continues to face some real challenges presented by COVID and the continuing closure of the Cadence Preserve, which is their primary teaching area. But they've been very innovative on finding new ways to reach the public and educate. And I'd encourage everyone who hasn't already to check out their website. They have a continuing series of free online presentations available, and really compelling, interesting stuff. So take a look. They've also been tremendously effective. Hat tip Caroline Elliott for responding financially to the COVID crisis, securing PPP loans, other grants, and have actually strengthened their financial stability during this very challenging time. And finally, Topsom Development, members of the CPIC team, Susan Ray Reeves and Larry Fitch, who serves on the TDI board, together with Rod, attended yesterday's TDI meeting to give us an update on the implementation process, review the matrix and the tasks that are allocated to TDI and ECD, and gave a review of how TDI can be effective in providing input to that process. The directors, in response to direction they got at your meeting on December 12th, when you requested the directors to draft some potential bylaw changes for your approval that could resolve the perceived conflict issues from dual board membership on the planning board and TDI. They met, that was part of their main focus of their meeting yesterday. They have voted on and proposed 3 revisions, which they will bring to you whenever you would like to see them on the agenda. Preliminary indication from Derek is that that will be that there'll be agenda space to come on February 4th. So we'll be prepared to bring it to you then. And that's it.
Unfreeze my mouse. John, you said you belong, you actively participate with CREA.
I serve on their board.
Can you, so is the entire preserve closed right now? I understand why CREA wouldn't be doing educational programs.
Well, actually, they would otherwise be because of the fact that it's a possibility to provide this education outside. So there's a lot of activity going on, for example, over in the land trust properties in Brunswick. But
so I don't understand why the preserve's closed.
Well, that was the decision of the underlying owner, Highland Green, and I think it's an attempt to mitigate risk, particularly for a senior community. So that was the decision that they made, and perforce CREA needs to abide by it.
Isn't that preserve part of a TIF agreement? And it should have been, it's a condition of?
Not to my understanding, it really wasn't referenced in the TIF documents that I've seen. The town isn't a party to the agreement. There is an easement between the landowner and the land trust. While CREA as an organization is the beneficiary and has its headquarters on that building, the easement actually is a grant to the Brunswick Topsom Land Trust. The town is not a party. That's one of the things that I looked at to that easement and agreement.
Well, thank you for looking at it, because I was into the same thought that it was part of a previous TIF, and just to shut down that entire area. I didn't understand if it was part of a TIF agreement.
Not that we have seen. I think as we come out of this, I think everybody's going to want to think a little more deeply about how we can manage this for everybody's benefit and safety. Because certainly it's when it's difficult to do things indoors, it's a shame, particularly for a facility that is aimed at educating and getting children in particular outdoors into nature and exercising and actually learning about it at the same time. It's unfortunate to have that withdrawn particularly at a time like this.
Yeah, it didn't make sense. Are there any other questions of John? Go ahead, Ruth.
I just wanted to follow up on what you're saying, Dave, what you were asking. How long is it the COVID is the risk, or are there other property risks or hiking through there, or what is the risk?
So far as I understand, it's only a concern about COVID.
Okay.
I mean, if anything, when we're under normal use out there, there's certainly more traffic on the trails and stuff, but the volunteers that support that organization and the volunteers who do a lot of trail maintenance, both from CREA and Brunswick Topsom Land Trust, do a truly astounding job of keeping things in great shape and safe. So yeah, it's not a wear and tear issue. It's a concern about COVID.
Thank you.
Any other question? John, when did the end, the dental place, when do they plan on opening?
They closed today. They are going to do some renovations and expansions to the property, which I believe will be coming to the planning board within a month, sometime in February. And I don't have a timeline on how long it's going to take them to do it, but it looks like they're going to do some building expansion of the envelope and either relocate and expand their parking a bit. So pretty exciting. It's a pretty high-tech, high-end dental practice, and it's really great to have it in Thompson.
Yeah, excellent. Thank you very much. Thank you, John.
Thank you.
I see no other hands. All right, so we are on to the correspondence portion of the evening, though due to technical difficulties, 373-5090 is not available tonight. I guess, no, because there's no microphone. So if you want a correspondence here with the board, you can use the raise your hand function and we'll keep an eye on that. Or if you do have to call the phone number, someone is prepared to answer and they can write your question down. I do have a correspondence here that we were given today. So I'll read that. It's from the Thompson Government Review Committee, January 5th, 2021. It is to the Board of Selectmen. Dear members of the board, we wish to take this opportunity to express our sincere appreciation for selecting us to serve on the Government Review Committee. We were all keenly aware of the importance of our task and took this responsibility quite seriously. Although many of us may have entered the process with some impressions as to what the outcome should be, each of us set those thoughts aside and conducted a truly impartial study. Our unanimous recommendation for the creation of a charter commission is in no way reflects support for or against a change in Thompson's current form of government. Rather, it was the result of many hours of research and discussion. We were not advocating for any modifications to address the potential issues that were noted in our report. That was not our job. We simply used them to illustrate matters that had been identified in previous GRC studies that can only be addressed with a charter, and that were still problematic from the viewpoint of a number of individuals familiar with the operational parameters of the town meeting form of government. We recognize the strong attachment many residents have to this honored tradition and their concern that it might change. However, although we do not believe that a charter commission can be limited in the focus of its proposals, we do know that a decision to make any change is one that will be made by the voters rather than by the members of a committee, commission, or board. This truly represents democracy at its finest. Please accept our thanks for your thoughtful consideration of our report. Please also accept our warmest wishes for a happy and safe new year. Respectfully, Thompson Government Review Committee, Matt Abbott, Chair, Susan Ray Reeves, Vice Chair, Ed Karen, Pamela Heil, and Ruth Lyons. This, the letter, oh, sorry, just a second, Ruth. The letter referenced that we had left this item tabled as we had questions. We have those questions back now, and I've talked to the manager, have that on February 4th's meeting. So we've got those. Let's keep moving this. We have the answers to our questions and we'll move this and vote on it. So I've looked for it for on February 4th. Ruth?
Yes, I look forward to February 4th, and we did get the answers, and that committee worked very hard. I've given this a lot of thought, and I don't think it ever hurts to review where our government is at. So I do support that part of it, but I do have a comment on it. And people seem to be very concerned that not many people show up at town meeting and there isn't a great representation. But people have an opportunity for a whole year. However, saying that, and this has been my bandwagon for a long time, we spend millions and millions of dollars at the town meeting for the school budget. Not one resident other than the selectmen or the school staff or the school board or the town clerks that had to be there attended those meetings. That's millions and millions of dollars. They have the same opportunity with that as they do with town meeting. I just wanted to say, I just happened to think of all these meetings that people don't attend and what do you do to get them there? So I just wanted to say that in conjunction with the letter.
Okay. I don't want to turn this into a debate on this subject right now.
Right, I know.
I just wanted to read the letter. We'll debate on the 4th.
It was just a comment.
No, I know. And I just want to make sure we stop there, but keep those comments. Say them again on the 4th, Ruth, please. So I just wanted to make sure we read that letter and everyone knows that it is coming back onto the agenda on the 4th. Did anyone else have any correspondence this week that they wanted to review, read, or discuss? Seeing nothing. Let me check. Looks like there are no hands up. So I'm going to just move forward. We have no adjustments for the agenda. Consent calendar approval of the minutes of the regular selectmen meeting, January 7, 2021. Make a motion that they're approved as submitted. Do I have a second? We got to move in a second. Patty, would you take that roll, please?
I will. David Douglas, do you approve or disapprove?
Approve.
Marie Brilliant? You're muted, Marie, and I can't tell what you're saying. Approve?
Approve? Am I, now I took my video off.
Ruth Lyons?
I
Okay.
approve.
Matt Nixon?
Approve.
And
Let me get it.
Roland Tuss.
Approve.
And Marie, if you did approve, it's 100%.
Okay. Yes,
Thank you,
I
Patty.
approve.
Thank you, Patty. Looking through one last correspondence. I don't see anything, but I will say to the board, this is a correspondence to you. I am going to put out, I've been meaning to for a little bit now, I think we need as a board, I'm going to put out a request that we hold a workshop. We have rules of order procedure for the Thompson Board of Municipal Officers. From what I see, the last time these were updated, 2009. And I think there may have been one reiteration since then. I may have an older copy in front of me. But I think we as a board need to, just take a look at it, make sure it's got everything we want in here. I will say it doesn't talk to anything digitally as we're doing now. So we probably want to have some things in there. So I'm going to put out that we just do a Zoom workshop and I'll work with the manager, but I'll give several dates for everybody that we do that. I think it's time we got to update these and make sure it's still what we want to be doing as a meeting and such in our roles and expectations. All right. We are on to new business 21-04, consideration and any appropriate action to approve authorization for the comp plan implementation committee to release a request for proposals for consulting services to assist in a zoning code rewrite and update. Susan, you live up to your word. You are here a lot. Take the floor.
Every darn meeting, huh?
It was funny. I read your name on the government review committee and I saw a vice chair and then I quickly looked. I'm like, oh, what is she on this one? Chair. Okay.
I figured out how I can delete myself and still be in the meeting. I'm getting really sharp here.
Exciting.
So, we introduced this last time. I guess it's called in your parlance, we workshopped it. We've had some time in CPIC as a full committee and in the formation of agendas are separate sort of planning work for the actual meetings. To talk about, the different ways we could approach this, looking at the zoning that is involved in the growth area that's covered in the plan, all of the various catalyst sites. We talked about different possibilities. It's been a long time since there's been any major review of that. There's been some amendments, some piecemeal stuff and things have been done, but this is an opportunity with a new comprehensive plan to look at this entire area. We looked at, should we pick one or two catalyst sites And the enthusiasm on the committee was, let's do this whole piece. Particularly, I don't know, maybe all of us are stir crazy with COVID, but there's an enthusiasm, I think, to use this time for the kind of planning before the serious action begins. This is an extended period, you know, issuing this RFP would allow us to get the help to do it as a piece rather than piecemeal. And even though I think Rod, in one of his memo for tonight's meeting, he talks about how this will be the major focus of the committee for the next couple of years. We're going to do other stuff. But the fact that a consultant will come in and sort of handle this work with us and with the town will allow all of it to move forward in a deliberate, careful way together, so that we'll come out with something that I think we'll be very proud of. And that's my piece. And now Rod can talk about the technical stuff and answer any questions, because I probably can't.
I'll answer questions. Susan did a great job.
Matt, go ahead.
Yeah, I had a question earlier today that I actually was able to get the answer from our venerable town manager, but I would be remiss without at least repeating that here along with the answer. I was curious about the source of the funding for the RFP itself, because I didn't recall an amount that large in our last budget. But it's been a contracted service amount for the last couple of years now, adding up, basically waiting to this point. So kudos to Rod for, I guess, planning. I mean, that's sort of his job, I suppose, though, right? But anyway, that was the answer I received, and that was an acceptable one for me, because it wasn't, I just didn't remember seeing a number that large in the budget this past year. But yeah, good stuff. Thank you, Susan, by the way.
Absolutely.
Fantastic.
Question I had, one thing I didn't see, and maybe it's a lesson we need to learn as we've done some of these other long-term contracts here in town recently. And we've got timelines in here, right? We want to be ready for 2023. Do we feel we need a clawback provision should times not be met, timing in any way? Is that a hindrance, forces quick work when maybe we're not 100% positive the timeline is exact? I just don't want open-ended and continuing on.
Agreed. In drafting the RFP, we went through probably 6 or 7 drafts, Dave, some of them with very specific dates and deliverables, and then thought to ourselves that in the contract, yes, I would agree that the scope of work that is proposed that we think best fits the description of the RFP, if they're not identifying their timelines of when they can get these things done and when they can deliver them versus us, I mean, I'm kind of putting the onus on the applicant to really sharpen their pencils instead of us saying by May 21 or, you know, some date that we'd like, that may be arbitrary. But I think in the contract, Dave, so if they give us those dates and then we set a contract that comes back to you to award the, you know, this specific firm with this specific contract, that language needs to be, I would agree with that. The contract that we sign really does need to be bulletproof.
Okay.
If that's what you're getting at.
No, it is, absolutely. And that makes sense though, because just because they scored the highest in the RFP, the negotiations don't stop. Right.
No, I think, you know, the details of the contract are going to be what we really need to focus on, making sure that that is exactly the deliverable gets met, what happens when it doesn't get met, all of that.
Yep. No, I think what you have here, I think is very good, and it related well to what you guys were talking about over the last couple meetings. I will say, putting in the estimated budget into the RFP, any of these groups with any salt to them, they're going to be able to research and find public documents that Topsom has X amount available, but advertising how much we have available, it's just a little personal thing.
I know that. Well, so I've had that backfire on us too, where we haven't done that, and it's tough in this. That's still up for grabs whether we put that in or not. But I mean, I think we need to identify some form of, we do have the money to afford something that we're asking for.
Yeah, no, and in any of these groups, I mean, it's not very hard to go find that we just talked about or watched tonight's Zoom meeting and know exactly what it was. So it's just in black and white's the part.
It's already out. The cat's out of the bag already.
That's right. Roland, did you take off?
Yeah, well, part of it was what you said, because my opinion is if they take the initiative, that tells us something as well. They know what we're doing. My question was, do you anticipate a certain number of companies to bid on this, or individuals?
We have a list of direct solicitation of over 10 firms throughout and outside of New England, even that have performed well on what we're asking for. So yeah, we have that list, and then we will advertise on planning listservs as well, American Planning Association and so forth.
Great, thanks.
Any other questions of the committee or Rod? Seeing nothing, I will make a motion that we allow the release of the RFP to go out on behalf of the comp plan implementation.
Second.
Got plenty of seconds and goings. Patty, would you take that roll, please?
I will. David Douglas.
I am in favor. I'm in favor.
Okay. Marie Brilliant. You in favor or opposed?
In favor.
Thank you. Ruth Lyons.
In favor.
Matt Nixon.
Favor.
And Roland Tufts.
In favor.
Unanimously in favor.
Thank you.
Thank you, Patty. And before we wrap up, I'm going to put it out one last time. This evening, we had an update from Lois Skillins and Dr. Bowe with Midcoast Hospital, and they gave us, they're going to begin a large-scale vaccination, and anyone 70 and above that fits the state's criteria that would like to attempt to have a appointment for that, you can call 877-780-7545. Be aware there are a number of people calling. You may just leave your information and you may get recontacted to schedule that. Or you could go to midcoasthospital.com/vaccine, and you can go there and do the sign up also. So, or you could rewatch this Zoom meeting tonight and you can hear all the information.
That's the best option. It's much more entertaining.
Dave,
Marketing.
it's Midcoast Health.
Okay, midcoasthealth.com/vaccine.
Yeah.
Thank you. Motion to adjourn. And we got all right. All those in favor? We're out. Right. Thank you, folks. Enjoy the weekend. Get your Tampa Bay 12 jerseys on.